Hey guys, it's Kaylin. We're going to go over our first lecture here. This is going to be, sorry, going to be discussing decision making, problem solving, critical thinking, and clinical reasoning, requisites for successful leadership and management. While these things are very important for successful leadership and management, they're very successful for the important for the successful bedside nurse. It's very important that you learn your problem solving skills, start to critically think, and have that clinical reasoning, those things that you learned and are starting to grow throughout your clinical experience while you're in the hospital. So decision making is just a complex cognitive process of choosing a particular course of action, the thought process of selecting a logical choice from available options. So, this is something as simple as I've come in, I have 3 patients to take care of for today. I've reviewed my chart, my information, gotten report on the patients. I have 1 patient that has medications due at 8 a.m. I have 1 patient that has no medications due at 10, and I have another that doesn't have any medications due until later in the day. So using my decision making, I may decide to go see that patient that has 8 a.m. medications due because they're the first one with medications due, and never maybe have anything else. They're pretty much both clinically look the same. So that would be a decision making. Problem solving is part of decision making, systemic process focused on analyzing a difficult situation. So maybe you have 2 patients, 2 of those 3 have medications due at the same time. So this is a little bit more difficult than just that basic decision making. This is more, okay, now I have to do some reasoning and think through this process, and which patient should I see first? Maybe patient A has meds due at 8 but has no testing for today. Patient B is scheduled to go for testing first thing in the morning. So I may see them first so I can get their assessment done, get their medications done before they go for their testing, and then I can see patient B because they're both stable. And then critical thinking, or reflective thinking as we're calling it now, is the mental process of actively and skillfully conceptualizing, applying, analyzing, synthesizing, and evaluating information to reach an answer or conclusion. This is a much more complex thought. You kind of use your intuition, your gut feeling sometimes to help then use the actual data that you see to make a logical conclusion. So characteristics of a critical thinker include insight, intuition, empathy, willingness to take an action, because you may have a feeling that you need to act on it. So maybe you feel something is going on with your patient, but you're not quite sure. So maybe that's sharing those feelings that you have with the physician, with your team leader, with another nurse to kind of talk through the disease process and what's going on with your patients, but a willingness to take action. Being creative, insightful, energetic, persistent, caring, resourceful, a risk taker, observant, kind of an out-of-the-box thinker, and knowledgeable. Critical thinking is one of those, and being a critical thinker is something that grows over time and continues to get better the longer you're in practice. So clinical reasoning, integrating and applying different types of knowledge to weigh evidence, critically think about arguments, and reflect on the processes used to arrive at a diagnosis. You collaborate and are reflective with the process that involves content-specific knowledge, engagement of the patient and family, and understanding of the clinical problem, and incorporation of critical contextual factors. So this is where you're collaborating. It's not you all on your own. You're going to collaborate with your respiratory therapist, your physician, your pharmacist. Many times you need the family to know what's going on with the patient. So maybe the patient can't communicate well. You need to know what medications are taking at home, what's going on with them, and you need to incorporate that family into the story too, so you can get more information. This leads to deliberative decision-making and sound clinical judgment. So various learning to enhance decision-making skills. I said various, vicarious, not various, sorry. Case studies provide stories that impact learning. These are frequently used in healthcare to provide more interactive learning experiences. You guys know this, case studies are used all the time in nursing. How often? It could be something that's actually happened where you've had one of your professors that shares a story from their past, or your textbooks in the lab. We're always using case studies because it really helps us as learners to walk through a process and understand things better. So case studies are fantastic. Simulations, that you guys use those as well in the lab, provide opportunities for learning with no risk to patients for organizational performance. So obviously simulations are very important because we don't want to be just practicing on people. If we have the opportunity to be able to simulate how to start an IV before we actually go do that first stick, you'll be much more successful with your first attempts at things. Problem-based learning, or PBL, provides opportunities for learners to address and learn from authentic problems. I'm sorry, excuse me. Successful decision makers. These people are self-aware. They understand when they may not know something, so they know who to ask. They're courageous because they're willing to ask for help and seek out more information. They're sensitive, energetic, and can be creative. So here's our first question. I'm sorry, that was my dog. Which is a characteristic of a successful decision maker? Somebody that's impulsive, A, B, has courage, C, decisiveness, or D, whimsy? The answer is B, somebody that has courage, as we've said multiple times. And this is because a successful decision maker should be willing to take risks. So problem solving versus decision making models. They're two different types. You have the traditional problem solving process and the managerial decision making model. So the traditional problem solving process would be, you would identify the root cause of the conflict. So what's going on, what is causing this problem? Gather data to identify the causes, the consequences of the problem. So then you would explore any alternative solutions. What are multiple things that we could do to fix this issue? Are there multiple things you could do to fix this issue? Evaluate each alternative. So the pros and cons to each. Select appropriate, and then select the appropriate solution. Implement the solution, and you would then evaluate the results. So you would look at each alternative, which one has the most pros over cons, would work for that patient or the situation, if it's talking about something on an entire nursing unit. And once you've chosen that you're going to implement it, you then always want to go back and evaluate your results, because maybe it wasn't the right decision and things need to be changed or made differently. So that's just the traditional problem-solving process. The managerial decision-making model is to determine the decision and the desired outcome. You need to have set objectives, research and identify options. So it's just not gathering the information, but you're actually going to go to the literature and look and see what are options based on what the literature says. You're going to compare and contrast these options and their consequences, generating as many different alternatives as possible. So just not a couple of things. You want to really see what are all the alternatives I could have, what are the consequences that could happen with each, so that's a really in-depth look at these solutions that you're trying to come up with. Then ultimately, once you've gone to the literature, you've looked at your options, you've really analyzed and seen what are my consequences, what can happen with these, which is the best option, you make a decision. You implement the action plan, create an action plan, and then implement it and evaluate your results. The big thing is you always reevaluate your results with all of them. So critical elements in problem solving and decision making: state a clear objective, gather data carefully, take the time as necessary, use an evidence-based approach. We talked about this a little with the managerial decision making. It's always important to look at the evidence in everything we do in our nursing practice. Whether you're going to your protocols or you're going to your policies, those should have been created using evidence-based approach. So you can see the links and the references on them and know that that is based on the evidence. And when you don't know, then you go and look up and see what is the best approach, what does the evidence say about this situation. So you want to always generate many alternatives, think logically, and choose and act decisively. So a problem-solving and decision-making model is always going to have your assess, diagnose, plan, implement, and evaluate. We always assess the problem. Let's look at everything that's going on, make sure we get all that information. I'm going to diagnose, I'm going to make a plan, and then I'm going to implement that plan and evaluate it in the end and see how did that go. Do I need to change it for next time? Did it work great? That kind of thing. And then if it works great, you can share that information with somebody else. So feedback mechanism of the nursing process, we said nursing process is always assess, diagnose, plan, implement, and evaluate. So next question. Which is not a factor in solving a problem successfully? A, using an evidence-based approach. B, doing all work independently. C, stating a clear objective. Or D, watching for faulty logic. Of course, it's B, doing all work independently. We never want to work in silos. It is important to use group process in some way to increase solutions. When you're just counting on yourself and working alone, that is really a recipe for disaster. You want to try to get input from others whenever you're looking to solve a problem. So questions asked in data gathering. Whenever you're going and doing your data, whether it's you're surveying or surveying a group of staff or nurses, or you're going and doing your data gathering in the literature and reviewing what others have done, you always want to know, what is the setting of my problem? What is the problem? Where is the problem? When is it a problem? Who is affected by the problem? What is happening? Why is it happening? What are the causes of the problem? Can I prioritize the causes? Which are the ones, maybe I can't fix everything. So what are my top things that I really need to work on getting fixed? What are the basic underlying issues? Are there any areas of conflict? What are the consequences of the problem, and which of these are most serious? Again, if you can kind of prioritize it and know which are your most serious is important. So questions asked in analyzing your solution, you should always know, what factors can you influence? What can I change and what can I not change? That's an important life lesson to know in your life. What can I change, what I can't change? How can you accentuate the positive factors and minimize the negatives? So, if you're talking to a group, what can I influence? What are the positive things going on? Let's bring it up, because there are always negative things going on everywhere, but let's bring to the group, what are the positive things too? What are the financial, political, time, and resource implications of each possible solution? Because as you guys will learn, a big part of leadership and management that you do have to look into is the financial, time, and resources, and political as well. These are huge, important things that sometimes we don't like to think about when we're just taking care of a patient, and not something that you always need to. But when you move into the leadership and management areas, they are big, huge portions of what you need to decide when you're problem solving and trying to come up with solutions for problems. What are the weighting factors? What are the best solutions? What are the means of evaluation? And sometimes we say, what are the best solutions? That seems simple, but sometimes the best solution might not be possible because you've had to weigh out those financial, time, and resources. So something that could be like, yes, that's the easy solution for this. Say maybe you have an issue in your storage rooms where the perfect solution would be tearing everything down and rebuilding it. Well, that's not possible. That's a best solution, but that's not possible for our time, resources, and financial needs. So what can we do with what we have and what we're able to do? That's where it's important to know that best solution. What are the means? How are you able to evaluate it? Because remember, we're wanting to evaluate everything. And what are the consequences for each alternative? So when you're coming up with your alternatives, your ideas for doing things, you want to know your pros and your cons. What consequences can happen based on what I'm wanting to do? So, I'm wanting to tear down my storeroom. If I decide we want to have a new, better process for the way everything's stored in our storeroom, we want to tear it down and rebuild it. Well, consequences, now where all your supplies going to go while you're doing that construction? Who's going to do the construction? How the cost of it? When maybe it could be another solution, that there's a new rack system we could use. or something like that. And there actually is literature on how to stock storerooms and different processes to use. That's another reason why you would go to the literature and see maybe there's a better process than just tearing things apart. So question, what is the first step in managerial decision-making model? A, identify the problem. B, evaluate alternatives. C, gather data. Or D, set objectives. The answer is D, set objectives. The rationale is that although the traditional model begins with identifying the problem, and when you're in the managerial decision-making model, one approaches the issue by first deciding on the objectives. So you first want to know what your objectives are, what are we wanting to accomplish here, and before you go on, just like identifying all your problems. So strategies for new nurses to promote evidence-based practice. You know, we really talk about evidence-based practice because it's so important in everything we do. We want what we do to be based on the best evidence. Things are constantly changing. So we really need to be looking at the literature and seeing what is happening now, what's most relevant, what does that say, and changing our policies, our procedures, and those things based on what the best evidence is. So keep abreast of the evidence, know what it is, read journals on in your specialty, be part of professional practice organizations because most of those will provide you with journals that are in your specialty and let you know of updates and things going on in that area. Use multiple sources of evidence, so not just looking to one area, but looking to different journals, different countries, all like that, those kind of things, making sure you're not just going to the same place every time. Use evidence to support clinical interventions and teaching strategies. So anytime you're changing an intervention or something that you're doing or a policy or practice, it needs to have clinical evidence to support it. And then whenever you're doing new education with staff or any kind of teaching, it needs to be based on what the most up-to-date evidence says, because you don't want to be teaching old practices. Find established sources of evidence. We talked about you need to have good sources for your evidence. Implement and evaluate nationally sanctioned clinical practice guidelines. So almost every area has clinical practice guidelines. You guys know I'm a stroke coordinator at Lakeland Regional. We have 300 pages of clinical practice guidelines that the American Stroke Association actually just redid and implemented January of 2018. So it's been 1 year now. And that was a huge change. It had lots of changes. So that was something where it was looking at the evidence, having to do education with staff, with physicians, based on what our clinical practice guidelines were. And it was also checking our clinical practice guidelines and looking at them and looking at what the evidence said, because a lot of times physicians want to have the case studies and literature to review when they're making their practice changes too. So question and challenge nursing traditions. Always be willing to ask questions. You never want to say you're doing something because that's how you always did it. If you don't know why you're doing something, then question why you're doing it and find out. And that really goes the entire time of your nursing career. When you're a brand new nurse, don't just do something because it's an order. Understand the process of why you're doing it. And if it doesn't make sense to you, you should question it. So strategies for new nurses to promote evidence-based practice. Continued, dispel the myths and traditions not supported by evidence. So, you know, this goes back to, you guys may have never heard of this. You may have seen it in some of your clinicals that when inserting Foley's, one of the old traditions and myths that everybody did was that you had to inflate the balloon before inserting it. And the thought was that you wanted to check and make sure the balloon would inflate and that it wasn't broken. Well, the reality was it was very, very rare that you had a balloon that was damaged and you were actually causing possibility of having more damage by inflating it and deflating it, and then more chance of cross-contamination while you're doing this check before you insert the Foley. So that was an old myth, and there are still nurses that do it, but it was a change in practice because the evidence supported. There were actually studies done that showed lower cases of UTIs, lower cases of issues with the balloon without checking it. So now today, we don't check the balloon before we insert our Foleys. So just an example of some of those myths and things that when you get out practicing, you may have nurses that have been away, that have been at the bedside for a long time. So they're used to these myths and these traditions, and it's good to educate them and let them know what you're learning now. Collaborate with other nurses to think globally. That's a big important thing, is to really collaborate, ask questions, and work on that. Interact with other disciplines to bring nursing evidence to the table. This is extremely important because you guys as nurses, there's a lot of nursing research out there. You have the opportunity to do research and case studies and things, and it's important to bring that up because our work is really important, and we're the person with the patient for the majority of the time, and a lot of times we can see and implement change that others won't, and it's a lot of great things have happened for patients based on nursing research. So question, tell whether the following statement is true or false. New nurses should question and challenge nursing traditions. This should be an easy one for you. It's true, of course. New nurses should question and challenge nursing traditions and promote a spirit of risk-taking in order to best utilize evidence-based practice. So the successful decision maker should always understand gender, personal individual values, life experiences, preferences, willingness to take risks, bringing hemisphere dominance, and predominant thinking styles. So some decision-making tools, which these are all these are in your book that you can review. There's decision-making grids that can be used, payoff tables, decision trees, consequence tables, logic modules, program evaluation and review techniques. You can review all these in your book and kind of look and understand what works best with your brain and take these tools and use them in your own decision-making. Here's an example of a decision-making tree. So this is, we're looking at, I have an issue where I need more staff. I'm trying to decide what about staffing. So possible events could be, I could have an increased demand of procedures. So say I am the manager over interventional radiology. I know that we're becoming a comprehensive stroke center. I could see an increase in demand of my procedures. What do I do? Do I hire more staff or do I pay overtime wages? You see your alternative actions. What can I do? Well, then you'd make a decision point. The things you need to really consider are revenue from the procedures. Is there a net cash flow, cost, first-year experience value? I'm thinking, is it going to be better for me to pay overtime to my nursing staff that I currently have? Because then I don't have, if I hire more, I have to pay them those wages plus pay for their benefits. So which is better? However, if I'm doing overtime, is that really what's best for my patient care? Because now I have fatigued nurses caring for patients. These are all things that are part of that you would use in the decision tree and things that you would think about to weigh when making a decision like this. So the economic man versus the administrative man. This is two different ways of managerial thinking. So you have the economic man that makes decisions in a very rational manner. They think things through. They have complete knowledge of the problem and decision and situation. Have complete list of possible alternatives. So they know what the problem is. They have really thought it through. They know all the alternatives that are possible. They have a rational system of ordering preferences. So they know the possible alternatives and then have rationalized which ones are best. And then select that decision will maximize utilities. So it's a really thought out process, the economic man. The administrative man more makes decisions that are good enough. So it'll fix the problem, but is it really gone and done the research and looked at the problem thoroughly? Probably not. Because they complete the knowledge is not, the complete knowledge is not possible. Knowledge is very fragmented. Because the consequences of alternatives occur in the future and they are impossible to predict accurately. So that can be an issue sometimes where you don't know what the future is going to hold. In that past situation, I don't know how many extra procedures I'm going to have. So I could hire new nurses on, but then I may not have the procedures to support that extra staff. There's not really a way for you to foresee that, and you don't want to wait till you're in a point where you need the staff to hire them. That's something that administration kind of has to deal with a lot. So the administrative man usually chooses from among a few alternatives, not all possible ones. They have like a few that they're considering. Like before we talked about, you know, I could hire extra staff, or I could have my current staff use overtime. They didn't talk about cross-training other staff in different areas. You know, they only had few alternatives. And the final choice is satisfying rather than maximizing. So it's not maximizing the process. Obviously, we'd want to be more of an economic man versus the administrative man, but sometimes in administration and leadership, you get put to a point where you have to be administrative because you don't have all the information and you're having to make decisions quickly. So that is it for chapter 1, guys. Make sure you read the material and go over it. I know it says questions and we're not in a live class, but if you have questions, please email me and I will respond to you with those questions within 24 hours if it's Monday through Friday. If it's after 5 p.m. on Friday, it'll be, or the weekend, Saturday or Sunday, I'll respond to you by Monday. And once I have those questions, I will create a question and answer video if there are multiple questions. So that way there might be somebody else in the class that have the same thing. Okay, guys, see you next time.